The storm is maintaining its intensity.
It's actually doubled in size.
This hurricane starting to come ashore here.
More than 1 million evacuated the Carolina coast.
You watch the news and they tell everyone stay inside, stay safe, stay dry.
The winds are just one of the storm's triple threats.
Everyone's glued to their TVs.
As Hurricane Florence swept through the Carolinas, most healthcare facilities were closed. So hospital groups across the state, including Palmetto Health, offered free virtual health care.
So Smart Exam is an online care tool where patients can go online, they can create their account, and in under an hour, they can receive care from a provider.
It covers over about 120 different conditions, very common conditions like flu, cough, cold symptoms, maybe a sinusitis, yeast infections, urinary tract infections. So they're very common, acute, but doesn't require you to go to emergency room. And so you can actually take care of all of that on doing an online questionnaire that's based on evidence-based medicine. So you ask you the right questions for the right symptoms, and then all of that is put together and a provider reviews it.
It follows evidence-based medicine protocols, and it will actually triage the patient out of the exam if we feel that they need to be seen in person and evaluated further. If they make it all the way through, they select the pharmacy of choice located within South Carolina, and a provider reviews and provides a customized care plan in under an hour. And so the patient is able to stay at home and get care for their simple visits.
Just need a browser. You can use it on your smart device, tablet, desktop, or laptop. And if you need an antibiotic, it'll actually know exactly what the closest pharmacies are, and it'll send it straight electronically to that pharmacy for you. And we had hundreds of different people who actually took part in using the Smart Exam and took advantage of that service, and a lot of great feedback in the surveys that we did, how easy to use and also how it let them take care of themselves without getting out in the harm's way with the weather.
We offered, over the course of the hurricane that hit our state, some places harder than others, we were able to offer Smart Exam at no cost to the community because we wanted to encourage patients to have a care avenue for their simple conditions. And so we extended care. We found out that we ended up treating a patient from Wilmington, North Carolina. To us, that was incredibly important. They were displaced from their home, came down to Sumter, and we were able to diagnose her in under an hour, provide her prescriptions, and really help her in her healthcare recovery process.
We offered to anyone. Actually, the website was open to anyone, even those folks who came and evacuated to parts of South Carolina. This service was available to them. And so again, it's not only just providing care to our community, but anyone who visits our state. We really wanted our South Carolinians to stay out of harm's way as Hurricane Florence went through our state. And at the same time, we also didn't want patients to feel like they had to wait for it to pass and get sicker and then end up going to the emergency room or in some cases in the hospital. So we wanted to be proactive and make sure we gave the service to our community so that they could take care of themselves.
If we can play one small part in the healthcare recovery process of these patients, while the rest of the country is participating in the infrastructure recovery process, then we've done our jobs and feel completely fulfilled in doing that.